Hey, it's Dr. Trish Leigh with another neurofeedback question, and I'm going to give you the answer. Okay, so the question today is neuroptimal type of neurofeedback, or really I'm going to classify neuroptimal into a category of what I call plug-and-play systems. Is a plug-and-play system just as good as the type of neurofeedback that many certified neurofeedback providers provide for people? Well, the question's kind of loaded, as you can imagine. In my world, any neurofeedback, as long as it is a quality system that's being provided, is better than no neurofeedback. So the way that a neuroptimal system works is, the reason I call it plug and play is because it really has one setting. And you may or may not know that neurofeedback is FDA regulated for stress reduction. So a plug-and-play system is going to be set for that stress reduction setting. So if that serves your needs, then that's better than nothing. But the way that neurofeedback works when you receive it at a qualified provider's office, preferably someone who is board certified by the BCIA and has learned how to acquire a QEEG brain map well and then deliver the neurofeedback care based upon what is found specifically in that person's brain. Clearly, more individualized, specific care is better than just general, global stress reduction care. So my issue with that is we serve many people here who their brain patterns are not one that needs stress reduction. So for example, if someone has ADHD and they really need to have the medium speed in their brain boosted, then a stress reduction protocol may not serve them. The way that we operate at Leigh Brain Spine, and really any qualified provider is going to operate in this way, is once we have your brain map, we are going to look at the very small nuances that are happening in the brain signal activity of every single area of your brain. And we can see it in the map. So first of all, we know what area of your brain needs to be adjusted, which is not always just the middle of the head where typically a plug-and-play system is placed. So if the area that is most dysregulated is up here in the frontal lobe, and you're using a generic protocol back here, it will not serve to adjust the brain signal in this frontal area. So that is my main issue with it, because if you are doing generalized neurofeedback up here at the middle of the brain, then potentially and eventually that the signal up here may be regulated a bit, but it's certainly not as efficient and effective as addressing that specific need of that area immediately and regularly. Secondly, we offer all types of neurofeedback in our office. And what that means is we're able to use different types of neurofeedback that serve different needs for people. An example of that is we offer what's called PZOK training. There's also S-Loretta training, and we're able to train specifically what we see in a person's brain map using more than one sensor at a time. So many providers will use one sensor, two sensors, sometimes three sensors. Definitely 4 sensors. We use 4 sensor training a lot in our office. Many providers are able to offer whole head training using a cap, and we do that in specific cases when people really need whole head training. So it really just depends on the needs of your brain. You want to have the most specific type of training to achieve your goals in the fastest amount of time. Okay, I hope that answers your question. So, of course, a plug-and-play system is better than nothing, but there are so many better options out there for specific, individualized training that can get you where you want to go faster and much more effective. Okay, hope that answers your question. Don't forget to subscribe and like below so that we can answer more and more of your neurofeedback questions so you can control your brain so it doesn't control you. Thanks.